Ahead in the national news tonight, the Bahamas among stakeholders seeking ways to curb the spread of HIV and AIDS in the region, the murder count climbing this weekend, and improvements on tap for Bay Street. The weekend edition starts right now.
Covering the islands of the Bahamas, ZNS Network presents The Bahamas Tonight.
Good evening, I'm Syann Thompson and welcome to The Bahamas Tonight. The search is on for ways to combat the HIV and AIDS epidemic in the region. More than 2,000 delegates will meet in talks over the next few days on this critical health issue affecting many in the Caribbean. During the opening of the 2011 Caribbean HIV and AIDS Conference last evening, medical officials and Prime Minister, the Right Honourable Hubert Ingraham, praised the work done today to sensitize and educate regional citizens on the epidemic. Our Altovise Munnings reports.
The flags representing each Caribbean island of the 2011 HIV/AIDS conference received cheers from the crowd. Then, the three conference chairs, Director of the National AIDS Program, Dr. Perry Gomez, Dr. Daisy Gele of the University of Puerto Rico, and Dr. Jack Whitescarver of the United States National Institutes of Health, all outlined the benefits of this event. Delivering the keynote address at the opening ceremony of the 2011 Caribbean HIV/AIDS Conference was Prime Minister Hubert Ingraham, who informed the attendees that the Bahamas confirmed its first case of HIV/AIDS in 1983, and 28 years later, the country has made tremendous strides in combating this disease.
Since AIDS was discovered in newborns in 1989, antenatal care treatment have been important in preventing mother-to-child transmission. Such care and treatment are provided by the government free of charge to all public and private HIV-positive pregnant women in the Bahamas. I'm happy to inform also that in 2010 in the Bahamas, there was no detected transmission of HIV from infected mothers to their babies. Notwithstanding the decline in new cases and a major reduction in mother-to-child transmission and decreasing mortality, AIDS remains a leading cause of death among Bahamian men and women aged 25 to 44.
The Prime Minister admitted that the Ministry of Health has been proactive in reaching persons infected with HIV/AIDS, but there are still significant challenges to overcome for diagnosis, care, and treatment, including stigma and discrimination. However, Mr. Ingraham revealed that the Bahamas has been a leader in developing legislation to protect the rights of minorities and others living with HIV.
In 1991, the Bahamas decriminalized homosexuality between consenting adults. And the Bahamas was the only Caribbean country to sign the Paris Declaration in 1994, which set global standards for HIV and human rights.
Prime Minister Ingraham also recognized the impact of HIV/AIDS on children and young people as a severe and growing problem. He then cushioned those statistics by illustrating 6 Bahamian children who were born HIV positive and are living relatively normal lives.
The best hope for containment of HIV/AIDS is a reduction in the number of new infections. We must scale up the prevention activities to be proven successful if we are to reverse the AIDS pandemic. At the same time, providing treatment and care of people living with HIV/AIDS remains absolutely essential.
Altovise Munnings, ZNS News.
Some special awards also presented during the opening of that HIV and AIDS conclave on Paradise Island. Among them, the conferral of the Pan-Caribbean Partnership Against HIV and AIDS Award and the conferral of the Caribbean Treatment Action Group International Preparedness Coalition Award. The United States Virgin Islands delegate to Congress, Donna Christensen, was honored for her work on AIDS in the region by famed actress Sheryl.
But as I stand here today, I challenge you within this time not to just go home having had a great time at the Atlantis, because you've got some hard work ahead of you. Hard work. Because we all know that some of the people and places and islands and countries that you will go back to, they are so ready to have this conversation.
Well, delegates getting down to business today, focusing on some key areas, with the Bahamas getting praised once again. This country making great strides in its pediatric HIV and AIDS care. In fact, leading health experts believe if the trend continues, the Bahamas could be well on its way to further decreasing or even eliminating the number of children affected with the disease. Our Giovanni reports.
Had great success in caring for children infected with HIV, those efforts even leading to international acclaim. In 2010, the Bahamas had 0 mother-to-child transmissions.
Very early, full, what they call HAART, highly active antiretroviral therapy, was offered to mothers who are pregnant. We've always, that's been the backbone of our program.
Noted pediatrician Dr. Percival McNeil was one of those health professionals at the forefront of the fight with what was then a new and uncharted development in healthcare. McNeil is proud of the Bahamas' achievements over the years, and he's optimistic that the disease can be reduced significantly in the youth population. But he says there are a number of challenges impeding that progress. For example, some children are simply not taking their medication.
The greatest challenge is what we call adherence, getting the patients to conform with the treatment plans. In pediatrics, there are a number of challenges, and I attempted to address those, or particularly that issue today, whereby how do we get the kids to take their medicines.
Dr. McNeil says there are also parenting issues. He explains.
There are a lot of kids who are loved, but the actual aspect of love with it is discipline and parenting that says, these are the rules, you will take it. They are challenges. How do we get that? Because that's what's going to save their lives.
Then there are concerns about what these children will do when they become parents. To date, there are 127 documented children living with HIV in the Bahamas, all under the age of 19. Dr. McNeil says the medical community is now looking at ways to address this shortfall, but as always, education will be key. Ideas on the drawing board include after-school programs where young people are taught life skills and lessons on managing children for their parents.
What we're proposing is, as soon as possible, as soon as we meet up with positive mothers, really working with them on their parenting skills and whatever their psychosocial needs are, so that they're prepared to deal with the kid as they grow.
Giovanni, Stuart, Zns News.
In crime news this weekend, police continuing their investigation into the country's latest murder. The incident reportedly occurred around 5:20 this morning on Prison Lane off E Street in the Fort Fincastle area. We get more details from the director of the National Crime Prevention Office, Superintendent Stephen Dean.
The police responded, and on arrival there, they found a male in his early 20s with multiple gunshot wounds about the body. We can say now we are not able to tell you the motive or what might cause this incident this morning. The police are actively trying to put the pieces together. Our detectives are on the scene. We still put the appeal out to members of the public who might have been walking this area, who might have been passing through the area, to please give us the information.
Police appealing to members of the public who may have any information regarding this incident to contact the Central Detective Unit. Meantime, police also reporting tonight that they've seized 500 assorted firearms along with 11,659 rounds of assorted ammunition. Authorities encouraging the public to make their best contribution in removing unlicensed firearms from our streets. Persons who are still in possession of unlicensed firearms are also being advised to hand them over to the police. Police have reported that conflict resolution has been one of the most common denominators of contributing to the high rate of crime. In order to assist, police continue to advise residents on the dangers of this issue. Today, the Good Samaritan Kingdom Ministries held a special seminar on conflict resolution at the Nassau Sheraton Beach Hotel. Bishop Leroy Emmanuel believes those in attendance obtained much food for thought.
When we look at our Bahamas and all of the things that are happening, we feel we as a church need to do something. Rather than sitting back and complaining about the problem, we should do something. You know, people say the church is not doing anything, but we are trying our best to do that which we know we should be doing as a church. Try to serve the whole man and do the best we can.
Speakers included Executive Director of Teen Challenge Bahamas, Pastor Eric Fox, and Director of the National Crime Prevention Office, Superintendent Stephen Dean.
You know, anger is a wonderful emotion. It's not bad. God has given it to you. It's not going to go no place. It's not the anger. It's what you do with it. It's like any other emotion. You feel something. It's what you do with it. It's not so much what you feel. And we live in the Bahamas where a lot of people are being controlled by how they feel. They feel something and they act. And we need to understand that anger is an emotion, but the response is learned.
A lot of us are just talking, but I think they are doing something with the problem, and this is an absolute great crime prevention tool. And we are looking at partners, corporate partners, and this is what the police want to get involved in. And we applaud these type of things when we see it.